Vaser-assisted liposuction. Vaser stands for Vibration Amplification of Sound Energy at Resonance, employs a newer generation ultrasound-assisted liposuction device that incorporates less energy with more efficient, solid probes. The probes come in an array of sizes and grooving, depending on tissues in which they will be used. The system uses less energy, decreasing its thermal component to the tissues. Garcia and Nathan showed the Vaser to have significant advantages in blood loss and recommended its use in large-volume liposuction procedures and areas of fibrous fatty tissue where excess blood loss is expected. Grooves in the probe near the tip result in radial dispersion of acoustic energy, yielding more effective emulsification with lower total energy application. These probes are 2.9 mm and 3.7 mm in diameter, so smaller incisions are required. The Vaser probe delivers energy to the tumescent fluid, and causes the gas bubbles within the fluid to expand and contract, causing the fluid molecules to continually get larger and eventually rupture. The rupturing of the fluid molecules causes the fat to separate from its surrounding connective tissue, blood vessels, and lymphatics, as well as causing the fat to separate from other fat. Vaser energy delivery technology enabled the surgeon to melt, debulk large areas of fat including superficial fat layer, therefore creating high definition of muscles around the body. It is imperative to avoid over-resection of fat and spare 1 cm of fat thickness from the deep dermis to avoid deep tissue scarring and irregularities.
The Vaser liposelection technique is unique, however, because it emulsifies fatty deposits and permits more effective removal while minimizing trauma to surrounding tissues. Using a medicated saline solution, infuse evenly with level strokes throughout the tissue to be treated. Vaser liposelection delivers patented, proprietary technology to effectively fragment and emulsify fatty deposits while leaving the tissue matrix largely intact. Vaser technology utilizes high-frequency 36,000 cycles per second ultrasonic energy. Vaser probes are offered in a variety of configurations for precise, efficient contouring of delicate to fibrous fatty tissue. The aspiration phase of Vaser liposelection effectively evacuates the emulsified fatty deposits with minimal disruption to the tissue matrix and consequently promotes smooth, contoured results with low to minimal pain and bruising and permits fast patient recovery. These typical results can be clearly demonstrated by comparing the contents of a collection container used in conventional liposuction versus one used in Vaser liposelection. Over time, emulsified fats continue to be evacuated by the body, largely due to post-surgical drainage and tissue remodeling in the healing period. Ultimately, Vaser liposelection provides excellent results for your patients without the disadvantages experienced with liposuction.
A Colombian plastic surgeon, Alfredo Hoyos, developed a significant improvement in the Vaser liposculpture technique, adding a new approach to body contouring. He termed this high-definition liposculpture. Dr. Hoyos defined his technique not just as a simple liposuction or fat removal, but as an artistic approach to sculpt the body and define the surface anatomy. Another advantage of the Vaser is the safety of the superficial emulsification and extraction of the fat from the subdermal lamellar layer to define relevant anatomy for each muscle group. As the subdermal plexus of vessels is not significantly affected with Vaser, this in our opinion is a major component in safeguarding the skin blood supply, allowing for further refinement in superficial fat extraction and three-dimensional body sculpting. Vaser liposculpture technology, however, is time-consuming when used for treating large areas. Hence, we recommend it to be performed by an experienced team, and perhaps when possible more than one team working in harmony. Laser-assisted liposuction. Laser-assisted liposuction technology is one of the most advanced treatment of lipodystrophies and irregularities of adipose tissue. The laser beam preferentially targets the adipose tissue with which it keeps a direct contact. Laser action causes the breakdown of the adipocyte membrane and releases the oily content into the extracellular fluid. It can cause neocollagen formation and remodeling with reticular dermis reorganization. Goldman and colleagues showed histologic evidence of coagulation of small blood vessels, rupture of adipocytes, reorganization of the reticular dermis, and coagulation of collagen in fat tissue with an updated 1064 nm wavelength neodymium, yttrium aluminum garnet laser. The most common advantage is patient's quick recovery. Due to liquefaction of the fat and small laser probe size, less effort from the surgeon warranted to melt and remove the fat. An important advantage seen in the early post-surgery stage is skin tightening related to laser energy delivery. Disadvantage of laser-assisted lipolysis is that the fat cannot be used for transfer following extraction. Skin burns have also been reported with laser use. There are several commercially available lasers on the market under different trade names. The most common available wavelengths in the United States are 924/975 nm, 1064 nanometers, and 1319/1320 nm.
Cynosure's Smart Lipo device for laser body contouring is a minimally invasive procedure. Smart Lipo can be used to treat many areas of the body, including the abdomen, thighs, hips, arms, and flanks. Using its patented ThermoGuide temperature sensing cannula and SmartSense motion sensing accelerometer, Smart Lipo allows you to treat with confidence, knowing that energy is being delivered safely and consistently. With 3 wavelengths in a single workstation, you can disrupt fat, coagulate blood vessels, and stimulate collagen for the safe and effective treatment of a wider variety of conditions and patients. First, mark the treatment location by dividing the area into 5 by 5 centimeter sections. After introducing the local tumescent anesthesia to numb only the specific area of the body being treated, insert the Smart Lipo laser fiber and ThermoGuide cannula through a very small incision site. Once the laser is armed and pulsing begins, use short strokes to be sure that the energy is delivered uniformly throughout each 5 by 5 millimeter section. The red aiming beam can be seen under the skin to indicate the center of the treatment spot. Carefully move the handpiece and fiber back and forth in a fan-like motion. The ThermoGuide cannula will detect when temperature limits are reached, and the SmartSense motion sensing handpiece assures that precise laser power is metered and delivered uniformly. When a sufficient volume of fat has been treated, discontinue lasing and palpate the treated area to identify uniformity of adipose tissue removal and symmetry of treatment. You may choose to manually aspirate the liquefied fat or use liposuction for larger volumes.
Rodrigo Nera et al. Described low-level laser-assisted liposuction, LLLL, known as the Nera 4L technique, show the likely formation of pores in the adipocyte wall following the action of an external laser. Low-level laser therapy externally applied through skin and preceding liposuction has also been proposed as a method to cause fat liquefaction before aspiration, but the utility of this treatment was subsequently disproved. Waterjet-assisted liposuction. A very different method to a controlled and gentle liposuction was introduced in 2000, when the method of waterjet liposuction was reported. Unlike traditional liposuction methods, the body jet uses a gentle jet of water to simultaneously dislodge and remove fat from the body, while sparing blood vessels, nerves, and surrounding tissue. The procedure is safe, effective and easy, offering outstanding results with minimal risk, significantly shorter procedure times, and less discomfort and recovery time for the patients. The method uses the energy of the pressurized fluid as well as a novel cannula system and suction unit. A fan-shaped liquid jet decomposes the fat tissue into fragments that can be cleanly suctioned out. Water-assisted liposuction, WAL, may represent a new algorithm in the continuous evolution and development of liposuction techniques and devices to remove fat for contouring and harvesting purposes. WAL utilizes a dual-purpose cannula that emits pulsating, fan-shaped jets of tumescent solution, followed by simultaneous suctioning of the fatty tissue and the instilled fluid. The fluid streams out from the cannula's nozzle tip at a 30 degrees angle to loosen the fatty tissue. The washed-out fatty tissue is evacuated from surgical sites through a separate channel within the cannula, which is connected to an integrated suction unit. The Waterjet technique uses an isotonic sodium chloride solution with an additive of adrenaline in the ratio of 1 ml to 3 L of sodium chloride solution. Advantages: more gentle than other forms of liposuction. Quicker, more efficient procedure. Reduced bruising and discomfort. Minimizes swelling, allowing more precise fat removal. Fat cells remain intact for transplantation if needed. WAL treatments are indicated for patients with moderate collections of adiposity and mild to moderate degrees of skin laxity, as well as for those who desire augmentation with their fat. Radiofrequency-assisted liposuction. Malcolm Paul and Robert Mulholland, 2009, introduced radiofrequency-assisted liposuction and soft tissue contraction technology. They showed that energy could be delivered to the dermis while heating the deep adipose and subcutaneous tissue to much higher temperatures without compromising skin safety. Radiofrequency, RF, is the latest technology to tackle face and body areas in need of rejuvenation. RF operation uses tripolar and biopolar radiofrequency modalities to heat subcutaneous dermal tissue using a handpiece emitting RF waves. This causes the contraction of the existing collagen fibers, encourages fibroblast migration and promotes new collagen growth that helps tighten and improve the outer architecture of the skin. The internal electrode is inserted into the adipose tissue at the desired depth for adipose and blood vessel coagulation. This insulated internal electrode probe emits the RF current through a small conductive tip. The external electrode has a larger contact area and is applied to the skin surface, creating lower power density in the skin than in the adipose tissue.
The body-tight contouring procedure uses radiofrequency energy for fat liquefaction and collagen contraction. RF current flows from the internal cannula towards the external electrode placed on the skin surface. RF power is regulated based upon online measurements of skin temperature and tissue impedance. The heat generated around the cannula tip coagulates blood vessels and liquefies fat to reduce post-operative pain, bruising, and edema. Uniform RF thermal exposure aids in smooth and even contour results. Simultaneous coagulation and aspiration of adipose tissue makes body-tight a rapid, one-stage procedure. Thermal contraction of fibrous septi and dermal collagen results in immediate body contouring, which continues to improve over the next 6 months.
During treatment, the internal cannula is introduced into the adipose tissue and can be adjusted for the desired depth of treatment. This adjustment can control the distance between electrodes in the range of 5 mm to 50 mm that allows for targeted treatment depth and uniform treatment by layers. Contact is maintained between the external electrode and the skin by a spring-loaded pivot. The external electrode has a larger contact area and is applied to the skin surface, creating a lower power density in the skin than in the adipose tissue. For large and medium volume treatment, the melted fat can be aspirated. For the treatment of small areas, such as the neck and face, the fat may be dissolved naturally through phagocytosis. Emerging technology.